Hi, I'm Hector Bremner with Avricore Health, and we're excited about our growth and what we achieved last year and what we're going to do this year in 2023. Let me show you why. HealthTab is our primary focus at Avricore Health, and we're helping move pharmacy forward. Healthcare needs are demanding new tools. There is more complex care needs out there. People are living longer. They have less access to a family physician, and the pharmacist is playing a new and key role in delivering more primary care. But again, they're going to need tools to meet this new demand. Part of driving that demand is chronic disease. It is an enormous expense to healthcare systems around the world. In Canada alone, it's $68 billion annually. 50% of Canadians over 20 have more than one chronic disease, and about a third of Canadians are either diabetic or pre-diabetic. These figures are staggering and obviously mean extraordinarily growing costs and complexity in delivering care. However, if you intervene early and people have a regular touch point with healthcare professionals, they've been proven to have better outcomes. So that's why pharmacy is transforming. They want to deliver those services. This is a $1.6 trillion industry globally, and it is shifting away from simply prescribing medicines or filling prescriptions out for people and moving more into a model where they will provide services on site in combination. This move is rapidly occurring as we speak, and this is a major disruption to this very large and very exciting sector. And that's driving point of care growth. Point of care testing is simply defined as anything that happens outside of a lab or a doctor's office. So it means you get a test on site with the results right now, and you can take action immediately. And so we see about a 9.6 CAGR and growth in point of care testing globally. It's expected to reach over $90 billion by the end of this decade. And some people think that it'll even blow past that. This is how quickly this sector is growing. And patients want this information because they're taking action in their own health. Many people, including watching this right now, have health apps on their phone where they're tracking a bunch of different metrics about themselves and activities that they do, and watching calories to doing more physical activities. These even doing their own genetics over the internet. So the patient has really become attuned to the fact that technology can enable their health decisions. And so they are looking for that now in combination with a healthcare professional, not just simply on their own through the internet. So we're focused on HealthTab, which is focused on becoming the world's largest, most reliable point of care testing network in community pharmacies. This layout here gives you sort of a perspective of the thinking of the platform. At the outset, the patient creates their own account, provides consents, agrees to terms and conditions for sharing of data. And at the time they meet with a healthcare professional, they will answer a customized health survey, which is a form of a follow-up with them. And they will also take a test on one of our lab accurate analyzers provided by Abbott. And the data is merged in the cloud, which produces personalized reports for the patients, but they get to keep their information, see how they do over time, which is proven to drive better health outcomes for them. But it also provides a platform for de-identified real-time data to be collected in a real-world setting that allows for really exciting opportunities for research and understanding what's going on in the public at large. This is another fast-growing area, which we're really excited about. Currently, we offer 23 biomarkers across 3 different instruments. Key focus right now is things like diabetes, looking at HbA1c or total cholesterol. Heart disease is obviously a big concern. So they're able to take a simple test, and within 10 minutes, both tests can be conducted and a consultation can occur with the pharmacist during that period of time. And a patient is walking out with results that they can rely on and an action plan to go forward and get better health outcomes. The testing menu, as I mentioned, is thanks to 3 different instruments. We've aligned with Abbott, which is definitely the global leader in point of care testing. Many of these instruments would typically live in an acute care setting, so like an emergency room or a hospital, maybe a physician's office, or a small laboratory. But we take these proven reliable, very well liked and respected instruments, and we move them into the community pharmacy, connect them to our proprietary cloud-based software, and use them in a platform way that is able to deliver the key results that a pharmacy and pharmacists will need in order to best serve their patients. So our primary focus at the moment in expansion has been around the Opinion 2, again, looking at A1C, lipid profile, and C-reactive protein. We are also currently deploying ID Now, and that is an instrument where you can get a molecular test done on site in just minutes for diseases like RSV, strep, influenza A and B, and even COVID. But the big focus right now is strep. Strep is a killer, and pharmacists can play a big role in tamping down not only the overuse of antibiotics, but also addressing serious infections before it gets too late. So currently we're about 450 locations. By the end of this year, we expect to be at approximately 1,000. This is going to be a combination of Canadian growth and international market development. And then the following, we expect fairly rapid growth internationally. So we are looking at a wonderful path to success for this year, certainly building off a big success the last year. And we think that we're on track for a 5-year growth spurt. And this is really something very exciting, something that the industry is absorbing well, in terms of the pharmacy industry is absorbing well. There's a lot of enthusiasm for what we're doing. So big excitement all around. And that's thanks to partners like Avid, which we've been really grateful. The team here in Canada really pioneered the journey with us, and globally the company has been very supportive. So why are they supportive, or why are people adopting us, or what is exciting about HealthTab? We're first to market. It's a dedicated point of care system for pharmacy. Nobody else is offering that, and nobody's offering a complete solution. People offer parts of what we do, but not entirely. And none of them offer a quality control program like we do. We use one of only 5 labs approved in the world by the CDC to do reference method. And what that does is ensures that we're overseeing the lots of tests that are conducted in a way that is at the same level, using the same lab, using the same process as a major conventional lab. We are the only point of care testing program on the planet that does this, and it is a sea change in the sophistication of the way that the program can be managed and the way quality can be assured. Data is also harmonized, which is a critical piece here. We're using the same analyzers across hundreds of points, collecting data in real time. This means you're getting great data, really important information on treated populations, so you can better deploy resources, you can better understand their needs, better understand their health journey, and help people stay on track on that health journey. And it's easily integrated. HealthTab is designed to collaborate and connect. We don't view other technologies necessarily as competitors even. We're always very clear that we want to be the provider of the data out of the instrument, and we are able to collaborate with all kinds of healthcare technology apps and are in some really fantastic discussions. And there's a deep interest in getting information from the HealthTab network into these very popular healthcare platforms. This means that HealthTab can act as fuel source for many of these for important health data and decision making, and those that are powered by AI and others will really benefit from having this type of information. And being pharmacy focused is also really important, that we do not want to become confused or distracted by other sectors and other markets and other opportunities. Pharmacy is a very large business, 1.6 trillion globally, as I mentioned before. It's very important to recognize that it is going through a moment where it's similar to the way the transportation industry was disrupted by things like Uber and Lyft, or hospitality was disrupted by Airbnb. This is the bringing of new technology into this setting that is much more patient-centered. The pharmacy is able to reach a lot of people. It's equitable. You don't need a special membership to go to a pharmacy. Anybody can walk in the door and get care. And thanks to technologies like ours, it is going to make it inexpensive and easy to deploy. So this is a real breakthrough in both what the pharmacy can do and what the patient can receive. We've partnered with Canada's largest pharmacy group here in Canada. We are proud to have scaled up to approximately a third of their locations at the moment and growing. They are pioneering a pharmacy walk-in clinic model, which is also very exciting, where in some jurisdictions in Canada, like Alberta and Ontario, and soon other provinces, the pharmacist is able to do more minor ailments work, which is to say that they have the scope of practice to handle more things that used to sort of clog up the GP's office. The general practitioners are swamped. Training them takes time, but even the incentive to become a general practitioner for a physician is not as high as perhaps specialization or other ways of practicing medicine. So the GP focus in the future is likely to be largely on diagnosis and direct treatment. Those key important moments, but a lot of those in between moments, those things like a prescription renewal or some minor ailment, like for example, like psoriasis is one of the areas where pharmacists can not only diagnose but also prescribe medication for it. So these are areas that's going to create a lot of efficiency in the healthcare system, but also a lot of opportunity in the community pharmacy to do a whole new line of business, which is service focused opposed to simply dispensing. In the initial pilot, there was 53 locations. Ultimately, it started with 12 and then grew to 53. The primary focus obviously was diabetes being so prevalent in Canada, and the outcomes were so significant. 80% of patients learned something new about their health, but 3 in 5 had a direct intervention in their health. And there was approximately 250, just about, people with diabetes who were identified that were undiagnosed. That is a staggering figure, and that is not even capturing the amount of heart disease that's identified through this process as well. So the reality is that there's a lot of weird and wonderful medical technologies and drugs and really specialized stuff out there. But the thing that must be remembered by everyone is that what's driving healthcare costs and bad outcomes, including death, is chronic disease. Chronic disease is manageable. It is preventable in a lot of cases too with early intervention. And so the pharmacy and the focus of healthcare in general is going to be on that kind of intervention, making sure people are on a plan, they have the information that they need, and they get to where they need to be health-wise in the easiest and most accessible way possible. And again, HealthTab is a powerful tool in facilitating that. The pharmacy walk-in clinic, as I mentioned, is a very exciting model. We're proud to have been integrated into these, both the ones in Alberta and in Nova Scotia, where there is a publicly funded program currently operating where pharmacists are being directly reimbursed for this work. We expect this direct reimbursement in Canada in 2023, as there is a significant new health accord being signed between the provinces and the feds in the coming weeks. It could put approximately $200 billion over the next 10 years into public healthcare. Part of that, one of the key line items has been around health data and also increasing access to primary care. And so the pharmacy across the country has been getting the expanded scope. What's been missing is the funding, and that's anticipated this year. So our roadmap for this year is further Canadian expansion, growing with existing and new partners. We also are excited about testing the UK and US as new markets. And we are also really bullish on driving volume. Our business, which I'll describe in a second a little bit, is financially is really driven by the amount of volume of testing being done, because we distribute the consumables, the tests that are being conducted on the systems. So we are really excited about direct reimbursement and expanded scope of practice in Canada and abroad, and expect very, very high demand for this type of testing in community pharmacy growing this year and through to the next several years. And then also more partnerships. So we're always looking at new collaborations, new technologies to integrate and collaborate with. And so we will drive new opportunities this way as well in 2023. So the company at the moment has benefited from a lot of growth thanks to our expansion and revenue growth. In 2022, the revenues are expected to be consistent and growing throughout this year. Demand is only increasing for us. So we provide a sensitivity in terms of revenue outlook, and we have a robust financial model that we use to forecast our future earnings and look at our business, understanding that what we're doing has never been done before. It's certainly not commodified in any way. This is true innovation. You know, the industry is rapidly changing as we speak. But we are very confident in our model, where we look at numbers of locations, patients per day, tests per patient. And so the net out for us is always generally very high. We are a good profit generating business. Last year, we generated over $2 million in revenue. The subsidiary, which HealthTab is a subsidiary company, that was in the black last year. So that is step one for us to being cash flow positive in 2023 at Avricore. And keeping in mind, we achieved that while growing. So we were investing a lot and still you know, proved out that we could grow and generate profits. So in the year ahead, we expect strong revenues. Our low target is based off of us simply just doing what we did last year at the level that we did last year, which we think is very attainable. And then the mid and high gives us some expectations if certain things line up, like significant increase in locations. But most importantly, the revenues will be driven by public funding and demand in Canada in particular. In the UK, for example, there is already public funding, and so we're seeing a lot of exciting opportunity there. And so we view the business as a strong cash generator. It is something that's going to yield great returns, and it's something that is not going to take a never plan to realize cash flow positivity. We expect cash flow positivity this year, and we will be able to maintain that in the go forward. And also want to underscore that we are self-funded. We were able to raise the dollars that we needed to grow, and we were able to manage those dollars well. We're now, you know, able, through a combination of revenues and conventional debt vehicles in the future, underpin our growth and make sure that we're prepared to do what we need to do. So thank you for your time. Of course, you can visit avricore.com for more information and get a copy of this presentation. But also, my contact is hector.bremner@avricorehealth.com. And you can reach out to me at any time with questions. Thank you so much.